Now, CAR T cell therapy is uh, currently the most common approved current cell therapy type. But as I mentioned, the other cell therapy types that we'll talk a little bit about are T cell receptor therapies, which use a different methodology, and NK cell or natural killer cell treatments. So with CAR T cell therapy, we take a patient's T cells, engineer them in a lab to carry a chimeric antigen receptor or CAR, and this gives them a new radar that helps them recognize a specific marker or flag on the surface of cancer cells. And once it's infused back into the patients, they will find and kill those cancer cells. Several of these therapies are commercially available for blood cancers, primarily leukemias, certain lymphomas, and multiple myeloma. And because it's available now, some patients may be eligible based on their cancer type, but it still carries risks and needs to be monitored at a specialized cancer center. T cell receptor therapies or TCR therapies, unlike CAR T therapies, are engineered so they can see flags that come from inside the cancer cells. And these flags are broken down proteins from inside those cells that are presented on the surface of the cell that are recognized by these engineered T cell receptors. This allows targeting of a broader set of cancer specific proteins and less risk for hurting our own healthy cells. This is mostly used in human clinical trials, or mostly being studied in human clinical trials, especially for solid tumors. So we're hoping to see some approvals in the next few years. But because this particular therapy often requires some higher level of matching for the patients, eligibility for these treatments is a little bit more complex. But it holds a lot of promise, and especially for cancers that don't respond to surface marker targeting therapies, this could be very useful. Uh, Probably the one of these treatments that I think is the most promising in terms of next treatments coming out are the NK cell or natural killer cell killer cell therapies. Natural killer cells are immune cells that don't need the same level of training as T cells to recognize harmful cancer cells, and as a result, we can more easily get these cells from a donor, so they can be made in advance without taking cells from a patient. And these NK cell therapies can be harnessed to recognize cancer cell flags from both outside and inside cells, and then kill those cancer cells. Many NK cell therapies are in active human clinical trials as well. And because these can be made off the shelf, meaning they can be made in advance using a donor cells, and potentially have less side effects than T cell based cell therapies, they may become more accessible to patients sooner in the near future. Now, CAR T cells that fight multiple myeloma, B cell lymphomas, and B cell lymphoblastic leukemias have been available for a few years. And you may notice that some of these cancers treated with CAR T cell therapies are the same ones historically treated with auto transplant, and that's not a coincidence. When CAR T was first tested in humans, it was used for patients whose blood cancer primarily didn't respond to auto transplants, meaning that they may be resistant to chemotherapy. Uh, but over time, this technology has improved, and especially for multiple myeloma and large B cell lymphoma, CAR T has started being studied and used earlier in the course of treating these diseases. In some cases, it can lead to longer remissions or even higher cure rates than transplant. And what's also exciting about these CAR T cell treatments is that since the ones designed to target B cell lymphomas um, have overlap with certain autoimmune diseases, because both involve B cells that can sometimes become overactive and attack the body's own organs and tissues. So this means the same science that's helped to fight cancer might one day be used to help people with conditions like lupus or multiple sclerosis or things like that. So it's a very exciting area right now. Um, Now, the other group of cells that I was mentioning, the NK cells, as I mentioned, are a type of first responder cells in our body. And unlike T cells, they don't often require a perfect genetic match when we infuse them into patients. They can also act when cancers hide those flags that the T cell targeted therapies look for on the cell surface. And so that's one reason why NK cells are believed to potentially have the ability to excel where other cell therapies might struggle. Now, one modified version of NK cells is called SIMIL-NK or cytokine-induced memory-like NK cells. And these are made when NK cells get a short boot camp with three cytokines, IL-12, 15, and 18, and this training helps them respond faster and stronger and produce more helpful immune messengers like gamma interferon that help them fight cancer cells. And so these simple NK cells have already started to show promising early activity, particularly against some types of leukemia, which are one of the groups of cancers that we have the fewest treatments for, as you may have heard earlier, as well as some solid tumors. And these are all in active clinical trials. And I have a few patients that have gotten these on clinical trials in the last few months. And it's very excited to see how they continue to do going forward. Um, Now, other next generation NK cell approaches include adding CAR, those chimeric antigen receptor um, uh, signals on the or radars on top of NK cells, so get kind of helping to further target these treatments. And these are still in very early studies. And then there's also induced pluripotent stem cell NK cells, which are those off-the-shelf NK cells I mentioned earlier, because this basically takes stem cells from donors and then induces them to develop into NK cells. Um, and then further, we go through a process of targeting those NK cells at the cancer cells of interest. And then there are also treatments that combine these cell therapies, like NK cell therapies, with antibodies to supercharge their effectiveness. And this is, one trial I'd recently seen was in CD30 positive lymphomas that may be responding to this type of combination of therapies. Uh, Now, again, the most important thing I think for patients with these NK cell therapies, in terms of why they're exciting, is that there's shorter manufacturing times. There's lower rates of severe cytokine release side effects and neurologic side effects. And so I think that this is an area I would keep an eye out for as we develop new treatments to treat both solid and blood cancers. Now, there are side effects to these treatments, and I recognize in time, I will, I'll mention that they group into two types: the infectious side effects like bacterial, viral, and fungal infections, as well as non-infectious complications like cytokine release syndrome, which is where the immune system becomes over stimulated from these new cell therapies and causes things like fevers, fatigue, shortness of breath, or low blood pressures, and needs some immune suppression in some sense to cool off the immune system through steroids or through other targeted treatments. Um, and so this requires very close monitoring in those first few days after the cell therapies. There's also neurotoxicity that can cause confusion or trouble speaking or writing or headaches. And again, this is usually reversible, but requires steroids and often very, very close monitoring in the ICU. And then there's other side effects like low blood counts and bleeding and nausea and vomiting and diarrhea, and common things that you think about in cancer treatments. And these are all treatable and reversed relatively quickly after the treatments are done.